that are issued by HS7. So these tests done with the URID specification could be done either in the Plugathon or in the Projectathon. So today I will just focus on the Plugathon to explain to you a bit how it works, what would be tested, and how you can participate. So I talked a lot about the Connectathon week, but just this image to show you a bit more what it is. So our main event is the Connectathon, of course, with the test of IHE profiles, but we have also other testing events like the XTHR Projectathon, where we'll be testing the IHE profiles that are included in XTHR deliverables. And also we have 3 plugathons, so the one on EHS primary use, the one on devices, and the one for open EHRs. Well, we also have conferences and so on, but I won't get to the detail of that. So I will present the three plugathons. So first, what is a plugathon? I think if you are here today, you know a bit what those events are. So it's early stage testing. The goal is to exchange between each other, resolve issues, prepare your system for more formal testing afterwards. And as we see today, we have educational part and hands-on session part. So the first one is the EHTS, then we have device and open EHR, as I was saying. So the first one on EHTS primary use, the goal, so we already had a session last June in Vienna during the Connectathon, and we'll do another one so in Brussels. So the participant will mostly test what Argir is presented, the different use cases. So on Xshare with the yellow button, but also on the wallet. So the goal would be for the participants to participate in those use cases, see the technical issues, create synergy between the different projects. And the goal at the end is to have a concrete feedback and to know where to advance with the different projects. So here are some practical information. I have all the links in the PowerPoint that I will be able to share with you. So it's 1.5 day with 1.5 day, education and 2 days testing. The second plugathon is the one on device. It will be focused on 2 IHE profiles. So the SDC and SDPI, which stands for Structured Data Capture and Service-Oriented Device Point of Care Interoperability. So the goal would be to test the test cases that have been developed before, to test, to use the tooling, and to have concrete feedback on what's going to be next for devices. So there is currently some kind of form to participate. So I have the link also in the later slides, so you can, if you are interested, you can book it. And the last one, on devices again, just the output. So to have a more defined core set of test cases, and to plan probably to test also in a Connectathon after, which is the next step for the testing after the plugathon. So this plugathon will be all week long, so from the Monday to the Friday, during the week of the 23rd to the 27th of March. And the last one is the plugathon on OpenEHR, and the goal is here to bridge FHIR to OpenEHR. So there will be some educational topics on the IPS, on some IHE profiles also, QDM, MHD, and so on. There will be some OpenEHR modeling methodology and some ways to map FHIR to OpenEHR and the opposite way. So you can come either, you don't need to have an OpenEHR system on an IHE system. There are a lot of ways so you can participate, and the goal is to bridge between the participants. So it will be educational session during the Wednesday 25 and then testing session during the Thursday. So you can come if you have either of those systems and those tests, but you can also come at any stage of maturity of your system. So if your system and this test is IHE, you can test if you need to get data from OpenEHR. If your system and the test is OpenEHR, is you can act as a data repository for the fireworks, and you can do the experimental bridge system to bridge between Fire and OpenEHR. So I'm not expert for this plug-athon, so if you have any question, please just write them to me and I will pass it to the person in charge of this. So if you want to register for any of those plug-athon, you can do it here with the different links. So I think for what is going on here in this room, the first one would be most probably the most interesting for you. So with the test cases that Argylis presented, and also I think if on the care plan there are some things that we can add, that will also be the occasion. So we will be doing some webinars beginning of February. So if you're interested, I think we can pass on also the information. And I think that's all for me. So if you have any questions about the plug-athons or Eurytis, otherwise I can stop.
Something about Vienna, how many participants were there, and if you compare expectations with the Brussels expectation.
Okay, so I think in Vienna we had, for the Connectathon itself, we were 220, I think. For the plug-athons, it depends. The plug-athons were made in a bit a different way. So we did not have the same as we are proposing this year, but there were more or less 100 people, I think. And with the conferences, we had up to 400 people a day. I think in Brussels it would be a bit more, since we have already more than 260 people registered for the Connectathon. And so we also added the XTHR projectathon and the plugathon. So I think we can expect 400 to 500 people each day to test. That's a really, really good event to be at. So I hope to see you all there.
and says, okay, let's look at what is part of the menu and then just.
Is that sort of kind of configuration with that information? Do they have example change or is it what they use?
Are you there? Are you ready?
Older GUI,
Okay.
the Epic releases, for users to do. So,
Hands up.
Mike. I'm taking the screen. Oh, one.
No niin, ei tarvitse monelta kalliimpi.
You see my screen, Mike?
Yes, I can see it, and it's shared here on the screen, and you have an audience of some 20, 30 people.
Okay.
Locally, and let's record this as well.
Yeah, I suppose I wait 2 minutes, right?
Yep. Let's start at even hour. Okay, Vincent, it's 4 o'clock here, so let's start.
Okay, thank you, Michael. Thank you for inviting me and allowing me to present this a few slides here. I will be talking about wallets and medical records. I know there's a pretty technical audience here, so I hope it's not too generic, too high level, because there's not going to be that many technical details for you guys. So just as a quick introduction, I'm a software engineer. I worked a lot in creating health record systems to exchange data, and we are also part of, with Andaman 7, the company, part of 3 funded projects by the EU. 2 have been closed now, Interoperate and Data Boards, and we are currently part of My Health at My Hands, like so many others around here, I heard. And the reason why I studied Andaman 7 is because I had a health issue some almost 20 years ago, cancer, and my son also, my very young son at the time. And we had we're still alive today, so very lucky. And I then built the Andaman 7 tool that I would have loved to have at that time. And it has expanded into a pretty interesting story, where now patients can have the Andaman 7 application that you can download, by the way. It's free, it's on the App Store, and your data is completely private, completely yours. No data in the cloud, no sharing of data by default. So the goal of Andaman 7 is to give citizens and patients control of the health data. Everything is on the smartphone, nothing in the cloud, as I said. And then with that, we hope to contribute to better care for patients and also to contribute to clinical research. So here are 5 elements of my presentation. A very brief EHGS overview, because I suppose most of you know about it. Then digital wallets, and then comparison to other projects outside of Europe. A few words on the My Health at My Hands project, and then a conclusion. But as you know, EHGS is a big thing in Europe, and that's very good that we're moving, and that we're moving in the right direction in improving interoperability and giving access to patients to their data, because that will enable better care and better research. I'm convinced of that. So you know that. Digital wallet and digital health wallet, what is that? Well, it's similar to what we use in real life, right? It's a way to store first the identity and prove the identity of a patient, especially important in online systems, in virtual systems. But it goes a bit further than guarantee or authenticating the identity. It may also contain a limited number of documents and information, typically transactional documents, I would say, like prescriptions and maybe even summaries of health of your health status, like has been discussed earlier in the day. And because it's electronic, it's quite powerful. It has new features that a physical wallet does not have, like zero knowledge sharing, like we heard that before also. And it's a very important piece of the global ecosystem, digital ecosystems that Europe is also focusing on with the ADAS and the EUDI initiatives. So for EHDS, it's a way to verify your identity and attributes. For example, vaccination elements, attributes could be I'm a doctor or not, or my age also. So various things related to qualities of the person. The OECD is defining that in a more flex way, saying it's the equivalent of a physical wallet. I have a slide on this later. So you can think of it as having different cards, like your identity cards, but also maybe a membership card or small documents about a prescription, so things like that. Where it differs from physical is that we are capable of doing new things like zero knowledge proofs, which, as you've seen earlier in demonstrations, is a way to say that you are over 18, for example, without revealing anything else, even your age, probably, right? So this is a way to augment privacy online, which is very good because there's less privacy online usually due to the capabilities of exchanging information. So it's good that we have things that are even better or stronger than in physical wallets. So physical wallets, as you of course all know, is a way to have your ID card or driver license, or which means I can drive, right? And other types of ways to certify things, documents and so on. And what's interesting is that in your wallet, usually you have money, you have cash. And that's not really a part of the EU wallet system for the moment, at least, right? So in digital, you have all the things that I mentioned earlier. And then there's the question of what do we put in the wallet compared to what do we leave out of the wallet? And that's where there is there should be a limit, which is to link to other systems for more information or more documents or heavier documents, I would say. Why is it important? Of course, you guessed that preventing fraud. It's so easy to pretend you're someone else online if you don't have strong identity authentication. It's estimated that 80% of breaches and people cheating online is due to weak authentication of the identity of people. So it's very important that we improve that, we make it easy, simple. We don't rely too much on passwords and things that people forget or can be easily brute force guessed. So improving both the level of security or strength of the authentication and making it as simple as possible are two very important elements. As some key opinion leader on security has said earlier, the secure way must be the easy way. Otherwise, it won't be used and it will be bypassed or not used sufficiently, and then there's going to be all kinds of problems, right? It's also a way to enable a cross-border trust, but I would even say cross enterprises, cross institutions, cross anything, right? If you have been authenticated in a context and you are in a in a second context and you trust the first context for their identity verification, then the authentication of the identity can be transferred to the second context. So that's also very important. So what's the difference between a wallet and a medical record? Well, if you look at a medical record of anybody, it contains a lot of information, right? A lot of past consultation information, lab results, medical exams, imaging exams, drugs being used or having been used in the past. So there's really a lot of information. It's usually it can still reside on a smartphone, like we prove it, except maybe for the very high resolution images. But otherwise, in Andaman 7, you can store all of your health record and it doesn't eat up all of your memory. So it's pretty, there's pretty efficient ways of storing your health record, but still it's much bigger than what a wallet is or should be. However, the wallet can be a bit more than simply a way to authenticate yourself or to prove some attributes or qualities of yourself, like your age. And it's sometimes very useful to have a subset of your health information directly in the wallet for easy sharing and for proving things or for giving some information to a new health practitioner or a new hospital if you're abroad or something like that. Right. So the wallet has the strength of being very portable. It also is a way to prove that a document is authentic or that prove also your identity, of course, your qualities, as we said, while a personal health record by default does not necessarily have all of these features. Of course, the good thing would be to combine the two, obviously. Voilà. So very quickly, let's compare the situation in the US, because the US has progressed a lot in the past 5 to 10 years, and in Europe we are a bit lagging behind, to be honest. So what we are trying to do with EHGS, the US has already done a lot of that in their country. Just to give you an example, Andaman 7, which is a small Belgian application, is compatible with 85% of all US hospitals. So that means that 85% approximately of American citizens can download Andaman 7, connect to the hospital and get a full copy of their health record locally on their phone. In Europe, we are not able to do that yet. Of course, the yellow button and the all EHGS, the APIs, the protocols will help us go there. So I'm really anxious, but also impatient that this happens. And part of this whole interoperability ecosystem, of course, the identification of people is important. In the US, they don't have that. And you may know that in most Anglo-Saxon countries, so including UK, Australia, in many of these countries, there is a resistance to a unique ID, like we have in Latin countries, for example, or Nordic countries, where having an identity card is normal. In the US, there is no identity card, right? In the UK, there's not either. So of course, you need to identify yourself or at least prove that you're a certain age for if you go to a discotheque, for example. And so what they use is their driving license. But it's a weird way of proving something, right? So it's a bit unusual. But it's the history that led them there and led us there. You probably know quite well the wallet implementation in the Apple smartphones and in the Google Android smartphones. So they have done work there that is of course pretty global because it is available in all countries where those systems are available, and that's almost all countries. And so these two major players offer an already pretty good wallet approach, which is still focused today more on payments and then also maybe your certificates for boarding a plane or your tickets, plane tickets, and also a membership cards, and all of these. So these are two players, but for the moment they don't play a significant role in healthcare in the US, as far as I know. And there's two other systems in the US that have a quite broad coverage, which are Clear and ID.me. Those are private companies, and they are mostly used to identify patients for health reasons. Not that's a consequence, because initially some of them were used for passport verification, online government services in the US, and various kinds of systems like that. The TEFCA is a new regulations in the US. It's probably 1 or 2 years old, and it's a way to combine all the interoperability improvements of the last 5 to 10 years into a more uniform. It's if you want, TEFCA is a bit the highways connecting all the cities and all the roads and the streets that have been built over the years to have a one global system in the US. Which means that not only before TEFCA, you would connect to your hospital and get your data, and then you would need to connect to your family doctor, get the data. With TEFCA, you can say, I'm connecting to the network, I'm identifying me with Clear or ID.me, and then I have access to all of my data wherever it is. If it's in 3 hospitals, 1 family doctor, and then some other store, you can have access to all of that. So it's one step further, and it's pretty interesting. There's all kinds of wallet initiatives globally in Australia, in Canada. Unfortunately, in Canada, it's province by province, so there needs to be more uniform work to be done. India is something that is very powerful too, and Singapore also. So it's something that is growing in many countries with, of course, different implementations. And if you want to be a citizen of the world, there's going to be a problem to be global. A very small example here in Belgium. I mention it because I think it's a pretty nice implementation. It's a combination of a group initiative from all Belgian banks and mobile operators in Belgium. And thanks to that, the banks have a strong identity verification of citizen before they can open a bank account. And with the mobile, you have a SIM card in your phone, which is linked to your identity also. So by combining the two, that is a private company. It's me. They built a very highly secure, but also very easy to use mobile app that gives you identity proof and zero knowledge sharing, and also it links to the biometrics capabilities of your phone. So just one example. There's, I'm sure, others in other European countries and globally, but just to say that there are some very nice initiatives. And then, of course, the goal for this system is to connect to the EU initiative, so that for the citizen and of the patients, it's still very easy to use. The My Health at My Ends project has been mentioned a few times today. So very quickly, it's a European funded project. The goal is to specify a few concrete use cases around EHDS, put in real world use in practice, and helping the patients being in control of the health data, and then sharing data, buying drugs online or in another country, exchanging health information in a country that is not your own country, and all these kinds of needs of patients that are moving around Europe. In that project, Andaman 7 is a member, like many others. There's many participants in this project, and what we are providing is our mobile app for patients, and we are adding to the mobile app the implementations of the various EHDS standards. Just a quick note is that it's not only for care and patients, it's also for research. So we are trying also to make sure that if the patients consent, of course, there must be an explicit consent of patients, then some of their data can be used for clinical research, which is important to find new drugs, new treatments, as my personal experience is showing. So in that project, Andaman 7 is bringing the patient side with a way to store all of the health data of patients locally on the phone. That is already working. And as I said earlier, you can download a version for yourself and test it. And what we want to do is to implement the client side, the patient side or the citizen side of the wallet, meaning the way to identify strongly people, the ways to prove some qualities like being a doctor, like being 18 years old and things like that. And also maybe include things that we are already managing today, for example, the IPS or the European Patient Summary. So in the basic software, we are already capable of downloading an IPS and understanding that and storing it locally in the various fields of the health record. And vice versa, we are also able to generate the IPS out of the data that is stored in Andaman 7. But then the next step, of course, as been demonstrated earlier today, is to add a signature of those documents and making sure and proving the identity of the person who created the IPS. For the future, as I said a bit earlier, there's going to be multiple ways to authenticate. Already today, in a software like Andaman 7, for example, we have to implement the American ways to authenticate patients, and we also have to implement Belgian and then European ways to authenticate patients. So all of these will have to be done, and it can be done separately initially, but of course, if you're a European citizen and then you go to the US, how do you prove your identity there? So there's going to be needs to have bridges between our European systems and other systems, the one I mentioned earlier, so that all wallets will be accepted in the future. So as a conclusion, wallets are great for identifying patients, so authenticating their identity and qualities. It's very important for privacy and for avoiding fraud. There's a very strong trend, and we like that, and we are part of that trend of having patients-led systems, not only provider
Jesus, preparing to kill.
Hi, Vincent, you rejoined. And you're muted.
I was going to say that wallets and health records are very interesting, but you need a Wi-Fi connection for that to work. Fortunately.
Wired connection, fine as well.
When did you lose me? After the talk, or?
Yeah, I think you were just opening up for questions.
Okay, yeah, I'm sorry for that. No, I'm open to questions if there are any, or if my colleagues did not answer them. I don't know.
We had some discussion here. Everything is resolved. And yes, we need to go towards your vision. So thanks for sharing it.
Okay. So I'm happy to answer any other questions if there are any.
Seems no other questions. Thank you.
Okay, perfect. Thank you for having us, Michael.
Thank you for attending, and let's keep on hacking.
Yeah. Okay.
Bye.
Good. Have a good day. Bye.
And I think we'll close the connections for today, and looking forward to see all of you remote participants tomorrow at 9 a.m. Finnish time.